helping make your life easier. Moms Every Day.
If you eat a food you're intolerant to, you'll feel pretty miserable. But if you have a true food allergy, eating this food could be life-threatening. Ashley Johnson is a physician assistant for Allergy, Asthma and Immunology Associates. Nice to have you here today, Ashley.
Thanks for having me.
So what are the symptoms then if you have a food intolerance?
So food intolerance usually involves the digestive system, so it'll be symptoms like gas, bloating, diarrhea, things like that.
Okay, burping, anything like that. Does it pass with some time?
Yes, usually it does.
Doesn't take too long to pass. Okay. So if you have a true food allergy, what would be your symptoms of that?
Okay. So a food allergy involves your immune system. So you can have several different organ systems involved. So the skin, you can have flushing, itching, hives, swelling called angioedema. It can involve the respiratory system. So you can have wheezing, shortness of breath. You can also have GI symptoms like vomiting, diarrhea with food allergies.
So it's a lot more intense.
Yes.
Is what you're saying. Can you get a food allergy at any time in your life?
You can.
Wow. And so you may have been able to eat, like, let's say, nuts before, but then all of a sudden maybe you can't.
Yep, true. So a food allergy, your body decides to recognize a protein as foreign at some point, so it can occur at any time.
All right, so we talked about nuts. What are some common food allergens?
Okay, so there are 8 common food allergens in no particular order. There's peanuts, tree nuts, fish, shellfish, soy, wheat, milk, and eggs, and those are the most common.
Okay, so you would have a similar reaction with any of those items? Okay, so if you think you have this, that you maybe are allergic to a food, what's your first step?
So you would want to come in and be tested for the food allergy. So you can either do skin prick testing, where the allergens will be placed on your back, and wait about 20 minutes to see if there's a reaction, or you can also do blood tests.
And if you think you are having an allergic reaction, should you get to the doctor immediately? Because it can be life-threatening, correct?
Yes, it can. If you think you're having a food reaction, you would want to go to the emergency room. And then in the future, you would most likely be prescribed an epinephrine auto-injector to have on hand.
To have on hand for safety purposes, but you would have to avoid those foods.
Yes, you would.
From that point on. Okay, good to know. Good advice today. Ashley, thank you for being here and telling us the difference between food intolerance and having a food allergy.
Thank you for having me.
And for more information on Allergy, Asthma and Immunology Associates PC, visit momseveryday.com.